Hello, welcome to our patient case file about Gina Smith. This is presented by our genetic counselors, Kaylin Cow, Jathan Cardenas, and Rianne Yang, and of course, myself, Michael Blaise.
Some background information for you is that Alzheimer's disease is a complex neurodegenerative disorder that primarily affects cognitive function, especially memory. The Alzheimer's disease is characterized by the accumulation of abnormal protein deposits, the amyloid plaques, and tau tangles in the brain. The exact cause of the Alzheimer's disease is not fully understood yet, but it's believed to involve a combination of genetic, environmental, and lifestyle factors.
Well, hello, Mrs. Smith. So now I'll be helping you going over the pattern of inheritance. So how can Alzheimer be passed? So Alzheimer can be passed by both genetically and non-genetically. So by genetic, I mean when you have a kid, your kid is going to have both a copy of your genes and a copy of course, your husband's gene. So if you or your husband has a gene called apolipoprotein, which is or it stands for APOE4, or APOE4, it's the strongest genetic risk factor for late onset Alzheimer. So of course, if you and or your husband has that, there's a higher chance that your kid is going to have it too, but it's okay. We're gonna help you go through this. And also non-genetic factors, meaning yes, Alzheimer can also be passed down, but can also be diagnosed if you or if there's no history of having Alzheimer's diseases. So, for example, if your kid in the future plans on working in a field, especially like an electromagnetic field, or working with pesticides, or also pre-existing medical injuries, those are all factors of your child getting Alzheimer, but a large part plays on, of course, genetic. So the earliest onset of Alzheimer occurs before the age of 65, still a long way. Often the ones that often longer, like the later onsets, would usually be influenced by a complex interplay of genetics and environmental factors. So now this is a pedigree chart. So this is it's kind of like a family chart, but it's not really. It goes more into details, especially it help us and help you to show a more like clear view of how genetics can be passed, or like diseases can be passed, disorders. So based on the information that you have provided us, you told us that your brother has a 5-month-old child, little baby, of having cystic fibrosis. So cystic fibrosis is the thing that causes Alzheimer. So what does this mean is that, so you see this black box here, right? It means that your nephew is for sure has cystic fibrosis. So it means that they could have Alzheimer. Well, now what does it mean when your brother and your brother's wife, the box is all shaded and yours is too, and of course your parents? So what this means is that you guys are affected by family history. There's a chance that from your side of the family, or it could also be your brother's wife's side of the family, have a family history of cystic fibrosis. Of course, this is a prototype pedigree chart because we don't have the full information to really put for sure knows who has what. My partners would help you go through the genetic testings and case recommendations that you guys can do to help, slow down the progressive of Alzheimer's disease.
Early symptoms may include difficulty remembering recent events, names, or locations. As the disease progresses, individuals may experience confusion, mood swings, and difficulty with language. Prognosis varies, but Alzheimer's is generally progressive, leading to severe cognitive impairments. More severe conditions. Alzheimer's can significantly impact the quality for both affected individuals and their family. Families should be prepared for the challenges of caregiving, potential finance strains, and emotional strains. Case recommendations. Genetic testing can identify mutations associated with the early onset Alzheimer's, such as mutations in the APP, PSEN1, and PSEN2 genes. However, late onset in the genetic components is more complex, and there are multiple risk genes such as APOE. It might not work for everyone. For early to mid stages of Alzheimer's disease, there are medications such as donepezil, galantamine, and ribostigmine to help with treatment symptoms. Things you can do: talk to your doctor, maintaining a healthy weight, stop smoking, be active, drinking only in moderation, get therapy if you have depression, practice precautions against head injuries.
All right, so questions and responses. First question is, what are the financial implications of Alzheimer's disease for the affected families? Well, there are many things that actually affect your financial implications, the cost of medical care, your insurance for it, medications, long-term care. But what's also a part of your financial implications is the cost to be a caregiver in the family. You might need to reduce your working hours or quit your jobs to care for them. However, most importantly, if you know someone that has this that you're taking care of, the best thing is to plan out everything. Always be one step ahead, never drag behind. For the second question, is there ongoing research in a potential cure or effective treatments for Alzheimer's? Yes, there is research going into for potential cures and effective treatments for Alzheimer's disease. Scientists are exploring everything from drug therapies to lifestyle interventions, and the advancements in understanding the underlying causes of this disease. And however, there is no cure yet, but soon enough, with time, like everything, we will advance enough to be able to make a cure. And finally, our third and last question, are there any hobbies or activities that have been shown to have a positive effect on cognitive health that may prevent Alzheimer's disease? Well, basically, there are, yes, there are. They include from puzzles, reading, learning new skills. All of these have positive effects, which could help prevent Alzheimer's disease, but also regular exercise and maintaining a healthy diet and staying socially active are also helpful with putting low risk. However, it should be noted that there is no guarantee of prevention methods that exist. These lifestyles only contribute to really your well-being, and honestly, that's probably something that we need to understand when it comes to Alzheimer's disease. And this is our final slide. Thank you all for listening to this. These are your options. Here are those questions. And if you have any more questions, feel free to ask. We'll be more than happy to answer them. Thank you.